So that's our proposal. This is where we've ended up. It's an approach that has been debated and changed and I believe improved over the last year. It incorporates the best ideas from Democrats and Republicans, including some of the ideas that Republicans offered during the healthcare summit, like funding state grants on medical malpractice reform. And curbing waste and fraud and abuse in the healthcare system. My proposal also gets rid of many of the provisions that had no place in healthcare reform provisions. That were more about winning individual votes in Congress than improving healthcare for all Americans. Now, despite all that we agree on and all the Republican ideas we've incorporated, many, probably most Republicans in Congress just have a fundamental disagreement over whether we should have more or less oversight of insurance companies. And if they truly believe that less regulation would lead to higher quality. More affordable health insurance, then they should vote against the proposal I put forward. Now, some also believe that we should, instead of doing what I'm proposing, pursue a piecemeal approach to health insurance reform. Where we tinker around the edges of this challenge for the next few years. Even those who acknowledge the problem of the uninsured say we just can't afford to help them right now, which is why the Republican proposal only covers 3 million uninsured Americans while we cover over 31 million. The problem with that approach is that unless everyone has access to affordable coverage, you can't prevent insurance companies from denying coverage based on pre-existing conditions. You can't limit the amount families are forced to pay out of their own pockets. The insurance reforms rest on everybody having access to coverage. And you also don't do anything about the fact that taxpayers currently end up subsidizing the uninsured. When they're forced to go to the emergency room for care, to the tune of about $1,000 per family. You can't get those savings if those people are still going to the emergency room. So the fact is, health reform only works if you take care of all of these problems at once. Now, both during and after last week's summit, Republicans in Congress insisted that the only acceptable course on health care reform is to start over. But given these honest and substantial differences between the parties about the need to regulate the insurance industry and the need to help millions of middle-class families get insurance, I don't see how another year of negotiations would help. Moreover, the insurance companies aren't starting over. They're continuing to raise premiums and deny coverage as we speak. For us to start over now could simply lead to delay that could last for another decade. Or even more. The American people, and the US economy, just can't wait that long. So, no matter which approach you favor, I believe the United States Congress owes the American people a final vote on health care reform. We have debated this issue thoroughly, not just for the past year but for decades. Reform has already passed the House with a majority. It has already passed the Senate with a supermajority of 60 votes. and now it deserves the same kind of up or down vote that was cast on welfare reform. That was cast on the Children's Health Insurance Program, that was used for COBRA health coverage for the unemployed, and, by the way, for both Bush tax cuts, all of which had to pass Congress with nothing more than a simple majority. I, therefore, ask leaders in both houses of Congress to finish their work and schedule a vote in the next few weeks. From now until then, I will do everything in my power to make the case for reform. And I urge every American who wants this reform to make their voice heard, as well every family. Every business, every patient, every doctor, every nurse, every physician's assistant. Make your voice heard. This has been a long and wrenching debate. It has stoked great passions among the American people and their representatives. And that's because healthcare is a difficult issue. It is a complicated issue. If it was easy, it would have been solved long ago. As all of you know from experience, healthcare can literally be an issue of life or death. And as a result, it easily lends itself to demagoguery and political gamesmanship. And misrepresentation and misunderstanding. But that's not an excuse for those of us who were sent here to lead. That's not an excuse for us to walk away. We can't just give up because the politics are hard. I know there's been a fascination, bordering on obsession. In this media town about what passing health insurance reform would mean for the next election. And the one after that. How will this play? What will happen with the polls? I will leave it to others to sift through the politics. Because that's not what this is about. That's not why we're here. This is about what reform would mean for the mother with breast cancer. Whose insurance company will finally have to pay for her chemotherapy. This is about what reform would mean for the small business owner who will no longer have to choose between hiring more workers or offering coverage to the employees she has. This is about what reform would mean for middle-class families who will be able to afford health insurance for the very first time in their lives and get a regular checkup once in a while. And have some security about their children if they get sick. This is about what reform would mean for all those men and women I've met. Over the last few years who've been brave enough to share their stories. When we started our push for reform last year, I talked to a young mother in Wisconsin named Laura Klitschko. She has 2 young children. She thought she had beaten her breast cancer, but then later discovered it had spread to her bones. She and her husband were working and had insurance, but their medical bills still landed them in debt. And now she spends time worrying about that debt when all she wants to do is spend time with her children and focus on getting well. This should not happen in the United States of America. And it doesn't have to. In the end, that's what this debate is about. It's about what kind of country we want to be. it's about the millions of lives that would be touched and, in some cases, saved by making private health insurance more secure and more affordable. So at stake right now is not just our ability to solve this problem, but our ability to solve any problem. The American people want to know if it's still possible for Washington to look out. For their interests and their future. They are waiting for us to act. They are waiting. For us to lead. And as long as I hold this office, I intend to provide that leadership. I do not know how this plays politically, but I know it's right. And so I ask Congress to finish its work, and I look forward to signing this reform into law. Thank you very much, everybody. Let's get it done. Barack Obama. Congressional Black Caucus Phoenix Awards Dinner Address. Delivered September 19, 2015, Washington, D. C. Hello CBC. I guess I get the fancier lectern here. Everybody please have a seat. Have a seat. I know it's late. You're ready for the after parties. I should have ditched the speech and brought my playlist. Everybody looks beautiful, handsome, wonderful. Thank you, Don, for that introduction. Thank you to the CBC Foundation. And thank you to the members of the CBC. On the challenges of our times, from giving workers a raise to getting families health coverage. On the threats of our time, from climate change to nuclear proliferation, members of the CBC have been leaders moving America forward. With your help, our businesses have created over 13 million new jobs. With your help, we've covered more than 16 million Americans with health insurance, many for the first time. Three years ago, Republicans said they'd get the unemployment rate down to 6% by 2017. It's down to 5.1 right now. You didn't hear much about that at the debate on Monday on Wednesday night. The point is, though, none of this progress would have been possible without the CBC taking tough votes when it mattered most. Whatever I've accomplished, the CBC has been there. I was proud to be a CBC member when I was in the Senate, and I'm proud to be your partner today. But we're not here just to celebrate, we're here to keep going. Because with the unemployment rate for African Americans still more than double than whites, with millions of families still working hard and still waiting to feel the recovery in their own lives. We know that the promise of this nation where every single American, regardless of the circumstances in which they were born, regardless of what they look like, where they come from, has the chance to succeed. That promise is not yet fulfilled. The good thing about America, the great project of America, is that perfecting our union is never finished. We've always got more work to do. And tonight's honorees remind us of that. They remind us of the courage and sacrifices, the work that they've done, and not just at the national level. But in local communities all across the country. We couldn't be prouder of them. The heroes. Of the civil rights movement whom we lost last month remind us of the work that remains to be done. American heroes like Louis Stokes, and Julian Bond, and Amelia Boynton Robinson.